This PowerPoint presentation is going to be exploring the topic of parasitic infestation of roundworms in equine by Taylor Nicole Gibson. So what is a roundworm? Roundworms are a part of the ascarid family, and ascarids typically live in the intestine of vertebrates. That's any animal with a spine. So all of the livestock animals and little pets like dogs and cats, they are susceptible to roundworm infestation. Roundworms, the scientific name for them is Parascaris equorum. Roundworms are very large parasites, so they can cause a major problem if there's too many of them in the intestines because it can cause blockage. So um, they can reach 15 inches in length. Actually, the females are the largest, so the males are a little bit smaller than the 15 inches, but females have been recorded to be 15 inches long, which is a very huge worm. They are round. They are yellow and white in color, and you can see them in feces. In this image from my reference 3, you can see the roundworms that have been excreted in the feces, and they are very large. This image shows the life cycle of the roundworm. They start out as a one-celled egg. That's where the life cycle starts because it's in the feces. That's how it's spread from an infected animal. In this case, we're talking about equine. So it has to be an area where there's species that already have the eggs that are in there that can infect the feed. So in about 1 to 2 weeks after the egg is in the feces, the egg hits the second stage of the larvae, and this is the infective stage. So it's in the feces, the soil, the stable, the walls, mangers, anything that has come in contact with the infected feces will be affected. So the horse ingests this egg by eating infected feed, water, drinking the water, or ingesting hay that is contaminated with the roundworm eggs. So after the ingestion, the egg hatch into larvae that burrow into the small intestine, and they actually travel through the veins, through the liver, and then through the heart, and then they finally end up in the lungs. So the larvae are then coughed up from the lungs, and then they are swallowed back into the digestive tract and return to the small intestine where the larvae will mature into an egg-laying adult, and this whole life cycle takes about 3 months. The signs and symptoms of infestation of roundworms would include unthriftiness, which is the failure to grow or develop normally as a result of the disease, which is the infestation of the worms. The roundworms, which is slow growth, basically. That's what unthriftiness means, is the growth is stunted, basically. Pot belly appearing, which if you think of like a pot-bellied pig, the stomach will be round, looking bloated, maybe mistaken as early pregnancy. That's kind of what the horse will appear like because of the size of the worms. It is expanding, taking up space in the stomach. Their coat, from lack of nutrition, having all those, their digestive tract is not able to absorb the nutrients from food as efficiently if they are not infested with roundworms. So the hair, the coat is going to appear rough and maybe kind of dull. Nasal discharge and cough result from the larvae migration. So this is that first kind of half of the infestation, the 1 to 2 weeks of when the larvae are migrating through the veins, through the liver, the heart, and then end up in the lungs. So when they're in the lungs and being coughed up, this can produce nasal discharge, and it can also create hemorrhages in the lung tissue. So lethargy and weight loss is also associated with the signs and symptoms of roundworm infestation. Constipation can be due to intestinal obstruction because of the size of these worms. It does take up a lot of space, and a lot of them can be blocking the digestive tract from working properly. And then diarrhea during that migration stage of the larvae can also be a symptom. So now we're going to look at how roundworms affect the equine. We already learned a little bit about their life cycle, what they look like. So adult horses will normally they develop an immunity to roundworms. So you see this a lot in younger horses. I did read one article that said less than 2 years, and then another one did say more less than 4 years. But there is the occasional case of an adult horse being infected with roundworms. So this next point says, as the current research infestation in adult horses is becoming more frequent, actually, due to the developed resistance to common dewormers, possibly the overuse of being on a strict deworming routine has enabled resistance in normal dewormers, the common ones, for these ascarids to continue to survive, where they would normally die when dewormed. So during migration, the larvae cause physical damage, actually. You can imagine, uh, such as inflammation, scarring of the liver. These worms are traveling through or the larvae are traveling through the liver. They can scar it, they can scar the lung tissue, and the coughing, that can be inflammation as what causes inflammation. So adult roundworms can cause physical damage due to intestinal blockage or intestinal rupture. The mild digestive upset and lower feed absorption, which we had kind of talked about, that kind of goes with the dull and rough-looking coat. Potentially severe colic, so it could be a little milder with just digestive upset, or it could be a more severe side of a colic, an actual impaction, and the horse cannot get its feces out because there's such a blockage. And if this is left untreated, it can cause death. So some preventative measures to protect your horses from being exposed to roundworm infestation would be good pasture management. So that's a major contributor. You need to ensure that feces are removed from the pasture at least 3 to 4 times a week. And if they're in a stall, it should be scooped every day, if not every other day, to ensure that those eggs, if from an infected horse, are not going to infect the feed, water, or hay that you will be feeding your horse. Pastures need to be avoiding overgrazing with too many horses. If you have too many horses per pasture, it's going to lead to feces cluttering the pasture, and it'll increase the exposure to roundworm eggs. It's good practice to alternate mare and foal grazing every year if possible. Deworm foals proactively every 6 to 8 weeks until the age of 6 months. And then you can go ahead and perform a worm count regularly thereafter and provide treatment accordingly. So we don't want to continue deworming adult horses even after the 6-month age because it can develop resistance towards those common dewormers, which was mentioned earlier. So worm count is a useful tool to control roundworms and should be carried out about every 3 months. You should check. And these are 3 references that I use to collect the information provided during this PowerPoint presentation. They are numbered 1, 2, and 3, so all the information I got is referred to as 1, 2, or 3, referring back to these reference sources. Thank you.